In Man vs. Wild, there is a guy named Bear Grylls who drinks his own urine to survive in extreme conditions. He can do so because he can pass urine. But what about the person who cannot pass urine? So today I am going to discuss a case of urethral stricture in which patient feels lots of difficulties to pass urine. So before moving on to the discussion part, I want you all to have a look at this prescription. When he came to OPD, he had a lot of complaints like difficulty in urine, dribbling of urine, and burning sensation while passing urine and severe bloating. And he was suffering from this problem since past 4 to 5 years. When he came to OPD, he was already taking allopathic medicine like norfloxacin 400 after food twice a day. And he was also getting his catheterization done twice a week to feel better and to remove all the urine out of his bladder. Every time he was paying 4 to 500 to get his catheterization done. Prior to inserting catheter, doctors use local anesthesia to decrease the painful sensation, and it also works as grease for lubrication purpose. So if aseptic condition is not maintained, then there are very high chances of having urinary tract infection, which this patient had. And he was also taking medication, like I already mentioned, it was Norflox 400. So when he came to my OPD with these complaints, the first thing that struck my mind was to advise him Uttarbasti. But I was not confident enough to do it because I never did it before, and it was initial days of my practice. So I just gave him oral medicines, and what I gave him, you have already seen in the prescription. I gave him these oral medicines for 15 days to decrease the Snayugat Vat, to strengthen the bladder, and also to make the sphincter flexible enough to work properly. And if you have noticed, he was a tea vendor. He was sitting at Galla. He was not supposed to leave his Galla even for a second. So because of which he was holding his urination urge for a long time. So whatever the symptoms he had, it arose from Mutra Vegavarudjanya Vyadhi. Acharya Charak says, Basti Mehanayo Shulam Mutra Kricham Shiroruja. Vinamo Vangshanana Hasyalingam Mutra Nigra. And the treatment of it was Svedavagahanabhyangan Sarpisaschavapidakam Mutre Pratihate Kuryat Trividam Basti Karmacha. So symptoms of Mutra Vegavarudjanya Vyadhi which Acharya Charak has mentioned, like Basti Mehanayo Shulam, which means pain in urinary bladder and penis. The next one is Mutra Kricha, dysuria, difficulty in passing urine, dribbling of urine, these kind of problems which patient is already suffering from. And after that, it is Vinamo. Vinamo means leaning your body forward, which is very obvious because it relaxes urinary bladder. It helps to reduce the pain a little bit. And at the end, it is Vangshananaha, distension of lower abdomen, which he already mentioned that he has severe bloating, which is originated due to Mutra Vegavarud. So back to the case. Next to next day, his mom came to OPD early morning. She said he had to do it catheterization done early morning because the pain was severe. Though I was a little bit afraid, but still I decided to go for UttarBasti. And I used all the knowledge that I had in the emergency medicine. I took 50 ml of Surcher there, took catheter and the local anesthesia Xylocaine 2%. After applying Xylocaine, when I was inserting that catheter inside the penis, there was a lot of resistance and it took me a lot of attempts to insert it. But after a lot of efforts, that catheter got inside. I had to do it gently, otherwise, there would have been a high chances of sphincter damage. So when they came for follow up, the moment his mom entered in the clinic, she started to bless me. And that guy was regarding me as his god. Uttar Basti can give such a miraculous result, even I couldn't imagine. Well, this is Dr. Hardik, and I create content about health and authentic Ayurveda. If that's something that relates to you, then do check out my page and consider following. Till then, Jai Mata Di.